live.
Hello, where you are, in fact, in a conversation with me. I'm Sneha Mordani, and we're going to talk about the COVID-19 situation in the country. And today was an interesting day because as everybody was just getting up from their sleep, news broke out that the Prime Minister has already got his shot against COVID-19. So in fact, there was a lot of discussion. Which shot is the Prime Minister going to take? When is he going to take it? Is he going to choose a vaccine which is in fact not in India yet, like a Pfizer or a Moderna? Or will he actually take a vaccine that has been developed in India? Will it be Covishield? Will it be Covaxin? But the Prime Minister, in a tweet that he sent out sometime after 7 o'clock this morning, he made it clear that he's taken a shot and he's done it at Delhi's All India Institute of Medical Sciences. That's his vaccine against coronavirus. 28 days from now, Prime Minister Modi gets his second shot. Remember, it's a 2-dose vaccine. Now, with that one decision, the Prime Minister did a lot of things. He tried to allay fears around Covaxin. Why are there fears around Covaxin to begin with? Covaxin is India's indigenous vaccine. Yes, questions have been raised about the manner in which it has been developed very, very quickly. Every vaccine takes about 10 years to be developed. This has taken less than a year. Hence, questions were raised. Opposition has called it BJP's vaccine also in the past. Efficacy data is still awaited given the fact that this is a vaccine that is still in the phase 3 trials. They are still in the process of unblinding their study, which means that efficacy data is not there. It has got restricted use authorization in a clinical trial mode. Lots of opposition states said, send us only Covishield, do not send us Covaxin. This, of course, upset the developers and also the government, given the fact that along with Bharat Biotech and Indian Council of Medical Research, this has been developed in collaboration with NIV Pune. All of these are government organizations. It's a government vaccine essentially. But the Prime Minister tried to allay fears around Covaxin by taking a shot of Covaxin. Later on, the confirmation also came in that he indeed had taken a shot of Covaxin, which is an inactivated vaccine essentially. Apart from that, he also tried to send out a message that he did not jump the queue. Why did the Prime Minister not take the vaccine in the month of January when the drive started? Because he was not eligible then. So he tried to send out that message as well, that I waited for my turn to come. He went to AIIMS in the morning. There's a video that has been doing the rounds of him reaching AIIMS in the morning, and he got the shot. There was no VVIP route laid, and he got the injection. He had filled out a consent form. He waited there for 30 minutes, followed all the due protocol, and then left Delhi's All India Institute of Medical Sciences. A lot of people welcomed this move, saying that this act alone is going to go miles in beating vaccine hesitancy in a problem, which is a problem in a country like ours, especially when it comes to a vaccine against COVID-19, not for any other vaccine, because India traditionally is a country that vaccinates against at least 19 infections. So we are fairly receptive when it comes to using a vaccine. But there was a lot of fear when it came to a vaccine against COVID-19, and I think this is in fact going to have fair amount of impact in dealing with the problem of vaccine hesitancy in the country. So how did today go when it comes to the vaccination drive, and how is this vaccination drive different from what started on the 16th of January? The one that started on 16th of January was for 3 crore healthcare workers, 1 crore healthcare workers and 2 crore frontline workers. Essentially 3 crore healthcare workers and frontline workers put together. That was the first phase of vaccination. They were on the front lines, and that is the reason why they were considered most susceptible. And who else is now most susceptible? These are the people developing severe infection and succumbing because of this infection. These are senior citizens and those people who are above the age of 45 and with underlying healthcare conditions. This has about 27 crore Indians. This includes 27 crore Indians. The government intends to involve and finish this process, involve all 27 crore Indians, get them vaccinated and finish this process by July 2021. It indeed is a tall order, given the fact that we've not even touched 2 crore vaccinations yet. But the sense is that with this opening up of registrations, there will be more people who will come forward and take the shot against COVID-19, and hence the pace of vaccination should pick up, is what the understanding within the government is. So how did today go? Today, we saw many places, in fact, welcoming a lot of people, allowing walk-in vaccinations. Some places did not do it. though the government has said that in this phase you must allow walk-in vaccination so that people have that option. As far as registrations are concerned, it was a bit of a problem. The COWIN software, it is cowin.gov.in. It's a URL. You type this and then you go and register. There is no app. There is no new COWIN app. I repeat, there is no new COWIN app. If there is something that is popping up on your phone, it is fake, is what the government is saying. There is no new app for this. You can use a regular desktop and go and log on to this particular website and register. What were the problems? Speed issues, internet issues, website not responsive, OTP not getting generated, details not getting filled in, vaccination slots not available. These were the glitches. Were they expected? Yes. Are they unfortunate? Absolutely yes. Because the intention is to get as many people to come and take these vaccinations, and it's a pity if the backbone of the vaccination drive slows down when the interest of the people is really what the government wants. So this is something that will be resolved with time, is what the government has clearly said. And apart from that, Arogya Setu, that is the app that you need to download if that's the route you want to take. There is a particular tab that opens up in which you can fill in your details, minimal details, age, sex, gender, also which ID you want to produce when you go to this vaccination site, and what is the proof of it. That is something that you need to put up in that particular website or Arogya Setu, and that's how you manage to get your registration. You can actually even produce your ID proof at the vaccination site if you are above the age of 45, and if you are having an underlying healthcare condition. The government has a list of 20 healthcare conditions. If you are suffering from any of the 20 or 1 or 2 or 3, say so in a medical certificate. The format of the same has been given out by the government, and take that certificate to the vaccination site and get your shot. 150 rupees for a dose, 100 rupees to administer the vaccine. So for 2 doses you will be spending 500 rupees in a private hospital, and in a government hospital it is absolutely free of cost. It remains to be seen how the drive picks up. Medical experts have been saying that this is the time to vaccinate, given the fact that infections are picking up in the country. Once again, we've reported again around 15,000 new cases. About a month ago, less than a month ago, we're reporting less than 10,000 cases. So certainly the infection is far from declining in the country, and we need to use this tool that we have now in our arsenal to protect all of us against the infection. Thanks for joining in.